Okay, good morning. I think we're going to start and just welcome everybody who's joining on the way. So my name is Agnieszka Carpenter, and I'm the Executive Director of BioME, and welcome to today's coffee hour. Today we're talking about AI, and we're doing this event in collaboration with the Government of Quebec in Boston. I think it's going to be a great coffee hour. For those of you who don't know what BioMaine is the Bioscience Association of Maine. We are a trade industry group devoted to advancing bioscience in the state of Maine and to creating opportunities for that community here in the state of Maine. And as I said, this event is organized in collaboration with the Boston office of the Government of Quebec, and we have some speakers from there, and we are doing it because for obvious geographical reasons, but also because we're always very impressed by the life science scene in Quebec. And I think for us Mainers, it's great to see what's happening north of the border from us. So a couple of logistics for today's meeting. I just want to say that the chat function is on, and I encourage everybody to leave their questions in the chat. You can also raise your virtual hand either now or towards the end and ask your questions in person. And yeah, if you just want to say hi and say where you're coming from, what companies you're coming from, feel free to use the chat function for that as well. And I also don't want to forget to thank all of our sponsors. So these are all of our annual sponsors. Without you, we couldn't be doing events like this. So we're very appreciative. And I hope we're gonna all have fun for the next hour. So our first speaker is Dr. Sam Scarpino from the Roux Institute. Dr. Scarpino will explain what AI is to all of us, I hope, especially in the context of life sciences, and also talk about the Roux Institute and updates from there, which is super exciting. Sam?
Great, thank you very much. I think, oh, there we go. All right. Well, thank you so much for having me this morning. I'm thrilled to be here. I'm looking forward to the rest of the talks as well. I think it's a very exciting set of conversations. Certainly wish that we were in a position to have these together in person, although I'm cautiously optimistic that those days are coming. Very briefly, Sam Scarpino, I'm an assistant professor in the Network Science Institute at Northeastern University. I'm also on the external faculty at the Santa Fe Institute and the Complex Systems Center in Vermont. At Northeastern, I have appointments in marine environmental sciences, physics, health sciences, the Curry College of Computer Science, and also at the Roux Institute, as well as the Global Resilience Institute. Our work primarily focuses on building mathematical and computer simulation models of infectious disease outbreaks, and then translating the results of those models into what we hope are improved public health and clinical decision-making practices. And we sit right at the interface of basic science practice and its application, which is why we're so focused on machine learning, artificial intelligence, and the role of data science in the process of making decisions, in particular as it pertains to pandemic response. So primarily in just a few minutes I have this morning, I'm going to say a little bit about AI at the end, but what I want to try to convince you of is that one of the big problems, and I think this is one of the opportunities in particular in Maine, but in very much in particular at the Roux Institute, is around data interoperability and bringing data to bear on some of the problems that we're currently faced. So why am I saying this? Well, if we think about COVID-19, one of the most striking features of this pandemic is how heterogeneous it has been globally. So we know there are countries, Vietnam, Thailand, Mongolia, that have largely kept COVID-19 out. We know there are countries like Australia that have locally eliminated it or locally eradicated it after it showed up. And then we know there are other countries, Brazil, the United States, much of Western Europe, that has been dealing with the pandemic in terms of huge losses of life, morbidity, mortality, economic effects for the better part of the past year. But if we zoom in on the US, we see the same kinds of heterogeneity across the country. This is just a current snapshot of COVID-19 across the US. Things are slowing down across much of New England, but they are still very much high risk spots throughout the US. And if we zoom in, as I'm sure you're all aware of in Maine, that the landscape has been heterogeneous across the state. Now, of course, some of that has to do with the urban-rural divide across the state, but other features, again, if we were to zoom into these counties, we would see similar kinds of heterogeneity within the county. And this is played out in terms of vaccination coverage. So here's a map from the New York Times showing the number of the percent of fully vaccinated individuals across different states. We see places like Maine and Vermont that are well ahead of the US, places like Texas, California, Utah that are lagging. And again, this is something that we see globally, in particular, the lack of equity and lack of equality when it comes to vaccination coverage, both in the US in terms of individuals that are minority, especially minority neighborhoods that have been hit hard by COVID as a result of the effects of racism. We see that at the global scale. So what does this mean? Well, this means that there is a complex and heterogeneous landscape of COVID-19, of vaccination coverage, of pre-existing immunity, of policies that are in place. And all of this makes it very difficult for us to build models that are going to be actionable and operational when it comes to making decisions around COVID-19. And this is the case across the biological sciences, across business sectors that are dealing with the effects of COVID-19 and will be dealing with the lingering effects of COVID-19. And so the real issue that we want to focus on is how do we bring the right kinds of data sets into our machine learning models, into our artificial intelligence systems, such that we have real-time operational information that changes as the landscape shifts underneath us throughout the course of an event like the pandemic or throughout the course of our normal business operations. Very briefly, I want to mention, just because of the individuals involved, that I have an active collaboration around pandemic response with Laurent Dufresne at the University of Vermont and Antoine Allard at the University of Laval. Laurent did his PhD at the University of Laval, so we have long-running collaborations in Quebec. Ben Althaus at the Institute for Disease Modeling. And I'm going to come back to this in a second. Some of the work that Laurent and Antoine have done over the past few years is to organize a winter workshop on complex networks that brings in individuals from the business world, academia, and government to learn about complex networks and analysis, the kind of things that we've done. It was in person in Quebec City for 2 years. Last year, we were remote. And one of the things that the three of us worked on was showing the importance of social network variation in COVID-19. That you have individuals that are at high risk of getting infected. You have individuals that are at high risk of spreading. You sometimes have individuals that are both at high risk of getting infected and at high risk of getting of spreading if they become infected. And this kind of heterogeneity, we've seen it play out at the national level, the local level, the global level, and at the individual level, means that we need high resolution, real-time data on individual social networks, on their mobility patterns, if we are going to have the kinds of data we need to feed into these artificial intelligence and machine learning systems, such that we can make decisions that are going to be relevant and meaningful given the data that are on hand. And so what are we doing about this in particular at the Roux Institute? Well, I'm a part of an international collaboration called Global.Health. It has funding support from Google.org and Rockefeller, institutions like Northeastern, Johns Hopkins, Harvard Medical School, Boston Children's, University of Oxford, University of Washington, that is curating a large international representative data set around COVID-19. We have over 25 million case records, but has also built a fully end-to-end cloud data platform for capturing, ingesting, deduplicating, anonymizing, and sharing out individual level COVID-19 records, but then has the capacity to respond in real time during the next pandemic. So as soon as the pandemic risk is detected via systems like Health Map that do artificial intelligence detection of pandemics, our data system rapidly spins up and can be deployed to start capturing real-time information. So we've captured 25 million cases across 160 countries, about 40 data points per case, travel history, symptoms, test date, demographics, occupations, country location. And we make all these data fully available. But one of the things that you can see is that these are just the case coverage of data, that the landscape of data availability is also heterogeneous. Some countries don't report on cases. Some countries do. Some countries have varying levels of granularity that they report on. And one of the things that we're actively engaged in is how we improve the data practices of various countries so that we can then improve our artificial intelligence and machine learning models. Specific example, I'm coming to the end here. We're tracking the variants of concern, the ones you've heard of, B1351, B117, P1, globally at the individual level as individuals move from country to country as they show up positive for these different variants of concern in the US and South Africa, China, throughout Europe. And we're building convolutional deep learning networks that take in information like genomes and predict things of interest like will the vaccine-derived antibodies successfully neutralize these new variants. And this is work that we're doing by pulling in data from sources like NextStrain that tracks genome information, pulling in data from wastewater surveillance, pulling in data from global.health, integrating those inside of a deep learning framework that includes humans in the loop that validate, verify, and pass information back into our real-time risk system that helps make decisions, for example, in Northeastern around reopening this fall and what that means in terms of our ability to proceed with normal business operations. And this is just an example of the kinds of individuals that are supporting us. Jacqueline Fuller, the vice president of Google.org, Dr. Larry Brilliant, one of the ones that was a part of the WHO's final round of smallpox campaign, Stephen Johnson writing in the New York Times saying that we may well have the most accurate portrait of the virus in existence. Rajiv Shah, who's the president of the Rockefeller Foundation, is one of our big supporters. And this is the kind of work that the Roux Institute is engaged in writ large in Portland, Maine, is bringing individuals who are subject matter experts together with individuals who are experts in artificial intelligence and machine learning, but critically sitting at this interface between basic science research and its operational relevance in the public-private sectors so that we can take academic work, bring it into the business world, bring it into government. We can build the kinds of data sets, the kinds of collaborations we need to fill these models with data, power them in real time, evolve as the situation evolves, and then train the next generation, not of academics, but of academics and individuals who will work in the private sector, who will work in government to continue to build out the capacity and realize the promise of artificial intelligence and machine learning. And Maine in particular, because it sits in such a special place with respect to the economy of Portland, the urban-rural divide, the rapidly changing landscape across the state, this provides a microcosm of what we could do globally as we think about how economies shift and change, how new technology sectors emerge, and the role of collaboration between academia, private sector, and the public. So I would encourage all of you to reach out to me, or I'm sure many of the other individuals from the Roux Institute on the call. We're very excited about the future of Northeastern and the Roux Institute in Portland, Maine. We have a beautiful new space in Portland, so as soon as it's safe to visit, we would welcome all of you to come and see it. And I'm excited for the rest of the meeting this morning. Thank you.
Thank you so much, Dr. Scarpino. We're also looking forward to going and visiting. So we typically do company tours or institution tours with a little bit of networking. So I'm definitely putting the Roux on our list. And once it's safe, we'll do that and we'll go and all see what's happening. Okay, thank you so much. Our second speakers, I should say, because we have two, are from a company called Cognaisent. And this is a company from Maine, and we have Ted Pine and Carla Emmons, and we will learn about how the company uses AI and what's happening in Maine on that front.
Thank you, Agnieszka. I'm Ted Pine with Cognaisent, and as she mentioned, joining me today is my colleague, Carla Emmons. And although we only have 10 minutes, I'm going to give you a bit of biography to tell you that my background is in market research and statistics, not health sciences, although I've spent the last 20 years of my career in sales and marketing. So at this point, my statistical chops are a little bit rough. That's a long-winded way of saying that I'm not a mathematician or a scientist, but I've been around long enough to have seen the classical AI project, which, if you may recall, consisted of programming expert systems from rules that are articulated by human experts. And there are several drawbacks to working this way. It's laborious to program an explicit set of rules, and it turns out that the rules that experts identify may differ from the ones they actually use. And so the classical AI approach has been supplanted by the modern AI approach, which infers a model from an analysis of the available data. In other words, the data, in effect, builds the model. And the most sophisticated of these approaches, we've already touched on that, are deep learning neural nets that build intricate, complex models by consuming lots and lots of data, so-called big data. And that works pretty well unless you lack the time or the resources to train such a model. And it turns out that not all problems are amenable to big data solutions. For example, think about novel disease outbreaks. So to address these sorts of fast-moving, real-time problems, we at Cognaisent decided to start with a clean sheet of paper, mathematically speaking, and design a machine learning algorithm that's not big data dependent. It does not require massive GPU clusters to execute, and one that would bridge the gap between classical and modern AI by building models from data while also outputting a hierarchy of intelligible rules. It's not a new flavor of neural network, and it's not a legacy technology. We have a novel and patented approach that we call GoFish, which stands for Generation of Features in Simple Hierarchies, which is a mouthful. And what's it mean? I can't take a deep dive into the GoFish technology in a 10-minute presentation. If there is interest, I'm more than happy to arrange a follow-up Zoom call to do that. But for now, using convolutional neural nets, AKA CNNs, as a point of comparison, I can summarize what differentiates GoFish as follows. First of all, we use vectorized representation of information rather than the pixel arrays or rasters used by neural networks. So keep in mind with rasters that an object from an input layer must be specified in a fixed location in an output layer. But objects in the real world, especially at the molecular level, they tend to wiggle and wander. So a neural network must separately mark each location where the same object may be found. What GoFish does instead is we map the relationships between objects using vectors, which are both scalable, and we also have technology that allows spatial relationships to be specified within a range of values. So it definitely offers some real advantages in applications such as molecular modeling, where entities are dynamic and they're not fixed. Second of all, we delineate the information that we learn about the relationship between objects using local rather than global boundaries and feature space. Now, if you can bear to look at this rather messy plot over here, what we're trying to show is a plot of feature space where blueness is clustered in the left center, and you see that redness creeps in around the boundaries. Now, it's very simple to capture this with a local function, which is what we've done here. Whereas CNNs, they delineate features by drawing hyperplanes that extend throughout the entirety of feature space. And what that means is if you want to demarcate the blue area here, you have to draw at least 2 hyperplanes that go throughout feature space, and probably more, and they'll extend not only in the region of interest, but way out to the boundaries where there may be no information at all. Bottom line is whenever you need to adjust the hyperplanes to better match the data, you also have to adjust weights across multiple global boundaries. Meanwhile, a multitude of other hyperplanes are being used to delineate other regions of feature space, such as redness or yellowness, and they in turn balkanize the blue region. So simple and clean, it's not. Finally, we build an explicit internal representation of the coordinate spaces and transforms that GoFish learns through training, meaning that when an object is classified as having a feature, such as blueness, the area, it's classified. Let me try again. It's classified that way because it has coordinates that place it in the area of feature space where GoFish has determined that such features as blueness are most likely to be found. By contrast, it's difficult with neural nets to discern any clear relationship between a given node and a discrete feature such as blueness, to say nothing of the relationships between nodes, which is actually where the important information about the location of objects resides. Now, this is not to discount the highly promising work that's being done in the area of CNN interpretability, but that's essentially a reverse engineering operation, and it's a step that GoFish entirely eliminates. So a rite of passage in the AI field is benchmarking your technology against the Atari game framework. And this is very famously where DeepMind first demonstrated its mettle. When DeepMind learned the Atari Pong game, it required 6 to 7 million training steps to achieve parity with the built-in Pong opponent. When we trained GoFish, it achieved parity in fewer than 1 million training steps. Well, what does that mean? It means that GoFish can match state-of-the-art deep learning results with less training data, but it also promises that in a mission-critical problem where accuracy is important, that when we're trained with a larger data set, we can likely beat the state of the art. Let me give you a real world example of this. We began looking, after we did the Pong test, we began looking for a mission critical real world problem that met the limited data criteria. We came across a study from MIT's Gifford lab that showed that a deep learning model could predict binding affinities between antibodies and antigens from sequences derived from HTS without the need for target structural data. Okay, so no additional panning enrichment steps or chemical processes. This model was trained using about 60,000 data points that consisted of CDR sequence snippets, experimental panning enrichment values, and positive or negative classification labels, meaning this is a good binder, this is a bad binder. Since the Gifford lab filed its data with the NIH's sequence re-archive, we were able to use their training data set to build a model using GoFish. And we were able to achieve slightly better accuracy than with Gifford's ensemble of 24 CNNs. So and here's the dog barking I promised you, Agnieszka. The process was this: we fed GoFish the binder patterns, the experimental values, and the rankings, good or bad binders. And then we loaded the sequences and mapped the patterns into an n-dimensional space, which turned out to be 800 dimensions, which is very hard to visualize. So imagine a spreadsheet with 800 columns with descriptions like, I can't believe it. I meant to say that was 800 columns and 3 howling dogs. So imagine a spreadsheet with labels that say things like the sequence has amino acid Q at position 3, the sequence has a length of 17, and amino acid Y at position 8, all the way up to 100 different promising sequences. For each output, GoFish assigns weights to each pattern, positive weights corresponding to patterns that indicate good bindability, negative weights correlating to negative binders. And it shows you specifically, and that's what's going on here, not only the weight, but which CDR fragments it found that were of interest. And that's what we mean by explainability. This is a promising result, but what we really want to show is that we can train on a fraction of those sequences. And not only that, but having trained on the data that's gone through experimental panning, we want to set GoFish loose on the 90% of data today that never makes it past the initial screening process in order to identify diverse hits that might otherwise be overlooked. In other words, given that the most effective and safe drug in the clinic is seldom the best one coming out of in vitro, let's find more diverse hits. We're confident that the weights of GoFish that it learns from the analysis of experimentally panned data when taken together can be used to make predictions about specific sequences or to suggest new test strings based upon the most dispositive patterns. But we can't do that with the Gifford data because it only contains the panning enriched data. So for that reason, we're looking for an academic or industry lab partner, hopefully with a lot of inoculated mouse sequence data, a certain amount of patience, and a good sense of humor that we can use to kind of finish our proof of concept. We think, by the way, it's generalizable to more than just bindability, that we could look at downstream properties like immunogenicity, et cetera. But as I said at the top of the presentation, we're not scientists, we're technologists, we're building a technology platform. In other words, we envision our technology not only running in your lab, but also in the vehicle that drives you to your lab. We can't do everything, and so we're looking for a partner, your data, our technology, ideally some joint posters and papers, and ultimately, if fortune shines on us, a life-saving therapy. Carla and I are both Mainers, and we'd love to talk with you further. If you're a lab, we'd love to hear about the research you're doing and to brainstorm with you whether we can help expedite your research. If you're an AI student or practitioner with a different application, we're also interested in discussing how we might support your initiatives, whether they're academic or commercial. As we mentioned, we're a platform company, and what we're doing is building out the equivalent of a TensorFlow environment for GoFish. So we are eager to collaborate. And I hope I didn't go too far over.
Oh, that's great. Carla, did you want to add anything or just say hi?
Hi, I'm Carla Emmons. I'm the COO and one of the co-founders of Cognaisent, and Ted pretty much summed us up pretty well.
Okay, perfect. I also wanted to say hi to everybody. I think we had quite a few people join throughout the event. And just a reminder, if anybody has questions or comments, use the chat function to leave them there. So I think we're going to move on. Thank you so much, Ted and Carla. We're going to move on to our next speaker, and that's Patricia Gruver from the Boston office of the Government of Quebec. And I mentioned at the beginning that, Quebec is important for us. because of the geographical proximity, but also because of what's happening there. In terms of life sciences, I think everybody's always looking south at Boston and Cambridge, but they're sort of overlooking that this whole life science community north of us is doing some amazing things. And I'm happy that we have Patricia here and Marina to talk about that. So Patricia?
Yep, and I'm gonna share my screen now with everybody. Okay, so thanks for the introduction, Agnieszka. I'm Patricia Gruver. I'm the Research and Innovation Attaché based at the Quebec Government Office in Boston. I've been there for about 3 years, and prior to my work in science diplomacy, I actually worked as an epidemiologist at Harvard and at the University of New South Wales in Australia. So all this COVID and life sciences stuff is, you know, part of what we were working on way back when. Well, not COVID, but other diseases. So yeah, I'm happy to be chatting to you all today about the life sciences because that's my background. So yeah, a little bit about Quebec, the AI and life sciences ecosystem. We have very strong government support to foster innovation in Quebec. We have a life sciences strategy, a research and innovation strategy, and the provincial government itself has spent about $1.7 billion investing in the innovation ecosystem in Quebec. With regards to the life sciences ecosystem, we have, like Agnieszka mentioned, we have more than 650 companies, just up a little bit north of you guys. We have about 56,000 skilled workers, and we've invested over $12 billion in health infrastructure. So whether that's hospitals, you know, new research facilities, that kind of thing, the government is very keen to support the life sciences industry in Quebec. So there are a lot of multinationals based in Quebec, as you can see here, and a lot of the major players in vaccines. And you know, we have more and more companies moving in to do specifically AI and life sciences. Seems like every month now. So Novartis just opened up an AI lab, and they're one of many multinational pharmaceutical companies that have opened up AI and pharma type projects in the Quebec area, specifically Montreal, where the hub of the AI ecosystem is. So here's some examples of, you know, investment in manufacturing facilities, specifically for vaccines. As you can see, it is a huge priority for the government to invest in this space. The National Research Council of Canada, so they're equivalent to the National Science Foundation. They have, you know, established their digital tech hub in Quebec. So they have their largest biologics dedicated R&D team in Canada with 340 scientists, and they work specifically on these 4 areas in vaccine development. And they also have partnerships with the multinationals that I was talking about earlier. So in terms of the AI hub, the Canadian government has chosen, a few years ago, has chosen Quebec for the Scale.ai headquarters. So that's Canada's AI supply chain supercluster. And so they're dedicated to building the next gen supply chain and boosting industry performance by leveraging AI technology. So not only has the Canadian government invested, I think, roughly 100 million Canadian dollars, the Quebec government has also invested in Scale.ai as well. And so that's up and running. And like I said earlier, one of the focuses is on supply chain manufacturing for vaccines and biologics. More about the AI Hub in Quebec. We have the largest and most prestigious group of deep learning researchers based at MILA, and that's the Montreal Institute for Learning Algorithms in the world. We also have multiple research centers, one at Université Laval. We also have the Institute for Data Valorization, also known as IVADO. There's been nearly $1.9 billion in AI investment announced in Quebec since 2016. So that includes both public and private. And as I mentioned earlier, $100 million has, over 5 years, has come from the provincial government to fund a Quebec AI cluster. Then there's the Pan-Canadian Artificial Intelligence Strategy. That's another $40 million. One of the unicorns that we have in Quebec is called Element AI, and they were actually just bought by an American company, but they received a very large amount of funding when they were fundraising for their startup. And we also have what we call Canada First Research Excellence Funds, and they fund these chair positions based at various universities for over a period of a number of years to work on specific subject matter. As I said, there's an AI dimension added to life sciences, and at the University of Laval, which has a lot of expertise in AI, there's a big data research center. And Université Laval, just an FYI, is based in Quebec City. It's not based in Montreal. And they're focused on a lot of bioinformatics issues. We also had the CHUM, which is a hospital based in Montreal, and they're running a school of AI and medicine. And one of the things that Quebec is really strong in, and that they're trying to make Montreal hub for, is AI for social good. So CHUM has integrated that into their studies. And then the UQAM, the Laboratoire d'Informatique, Bioinformatique, is focused on developing AI for biological data interpretation. So that's kind of where these centers of research are, where a lot of the AI and life sciences sectors cross. But today we're lucky enough to have Marina Massingham here from Aifred, and she's going to talk a little bit more about how her startup also crosses those two, or there's a link between those two sectors. But before we head to Marina's, I just wanted to talk a little bit about some of the tech giants that are based in Quebec, and like I said, mainly Montreal. So we have Google, IBM, Microsoft, Samsung, Thales, Quantum Black, and like I said, there's a ton of multinational pharmaceutical companies that have some sort of AI lab presence in the Montreal area, such as Novartis and others. And so just because we, how did this come about? We have, Quebec is a robust R&D hub. We have the highest level of R&D spending in Canada in proportion to its GDP. And nearly 30% of Canada's R&D jobs are found in Quebec. We have the largest number of university researchers in Canada, and 3 of Quebec's universities are among the top 10 of Canada's research facilities. So here's just a look at some of the universities that are based in Quebec. So many of you probably have heard of McGill, and those are some of the focus areas and strengths of McGill University listed underneath. So artificial intelligence, viral vaccine manufacturing, vaccine evolution and development, cybersecurity, things like that. Biorecognition and sensors. Laval University has an infectious diseases center. We also have the INRS, and they are working on a vaccination platform as well. Sherbrooke University is actually one of the hubs that IBM has designated as a quantum hub. So I know this is about AI, but for quantum science, they are one of the leaders in the world. And then University of Montreal, they're working on a lot of AI stuff, as well as bioprocess development, Industry 4.0, biosensors, viral vector production. And then lastly, we have École de Technologie Supérieure, and they're working on data scientists, AI, and additive manufacturing. So just before I hand it over to Marina, I just wanted to say a few words about the startup ecosystem. So we have more than 80 incubators and accelerators in Quebec, and we have over $800 million in US venture capital invested in 2017. So as you can see here, this is just a small representation of the number of incubators and accelerators that we have in Quebec, and they support the startup ecosystem that we have up north. And then here's a sample of some of the leading life sciences startups we have in Quebec. And so, yeah, there's a number of them. And I think this is a bit outdated because I don't see Aifred there, and they should be there. But sorry, Marina, but she will talk about why they're, one of the big startups based in Montreal right now for AI and life sciences. And then, like I mentioned before, there's a lot of government support. So we have sector tax credits, we have R&D tax credits, we have grants to cover labor development, and grants and interest-free loans for major investment projects. And so, merci beaucoup, everyone. And if you have any questions, feel free to reach out to me. This is my email. And I know Agnieszka said that she'll be sharing emails if anyone's interested as well.
Yes, absolutely. Thank you so much, Patricia. This was really, really interesting. And also for people who are not familiar with what's happening in Quebec in terms of life sciences, AI, and startup culture, I think you learned something. I also wanted to really stress the government support and investment and incentives. So if there are any of our state officials here, please take a look at Quebec. I think it's a great model. Okay, so with that, let's move on to our next speaker, Marina Massingham from Aifred. As Patricia mentioned, that's one of those great AI companies, startup companies out of Quebec.
Thank you very much, Agnieszka, and thank you for inviting us today, and Patricia for the very kind shout outs during your presentation, much appreciated. I'll send you our logo at the end so you can put us on that page. I don't have a slide presentation today, but I wanted to take the opportunity to introduce myself. I'm Marina Massingham, the President and CEO of Aifred Health. My background is in management consulting and in consumer goods, and I've been in the life sciences space for about 10 years now. Included on my CV is one of the companies that Patricia mentioned, Novartis. But as Patricia was also talking about, there's an amazing startup ecosystem here in Quebec. There's some great accelerators, there's tremendous government support. And I can honestly say that Quebec unlocked my inner entrepreneur when I moved here nearly 7 years ago. Aifred is actually my third healthcare startup in Quebec. I had successful exit with my first in 2015. I worked for a couple of years for the company that acquired us, and I joined Aifred as professional CEO back in January of 2019. The Aifred's focus is clinical decision support in mental health. There are a ton of mental health care startups out there. 99.999% of them focus only on the patient. Aifred focuses on the physician, helping the physician to make better decisions in the care of their patients with mental health conditions, starting with depression. If you look at the US, and the stats are pretty similar for Canada as well, about 60% of patients who suffer from depression will only ever see their primary care physician. They will not get to see a specialist psychiatrist. And family physicians are terrific, but they are not well trained and well equipped in the management of complex mental health conditions like depression. Unfortunately, particularly during the time of COVID, the mental health burden on the population is continuing to increase, and waiting lists for psychiatrists are getting longer and longer. Our goal is to help these physicians to make better decisions in two areas. One is treatment management, so understanding where the patient is on the disease cycle and what to do next. And the other area is treatment selection, understanding how to match the individual patient with the range of first-line treatments available to that physician to give to the patient. The goal of our technology is to get more patients to remission and to get those patients to remission faster. Today, I'll talk a little bit about treatment selection because that is the sort of sexier end of our technology, and this is where we've developed our AI model. So we have spent the last 4 years developing an AI model specifically around treatment selection, helping to take in sociodemographic information, behavioral health information, and using that to understand the probability of remission for an individual patient for an individual drug, with the goal of solving the problem of taking the trial and error approach out of treatment selection. Today, a physician, whether they're a PCP or whether they're a specialist, can have a great conversation with their patient. They could spend 2 hours with their patient if they had that much time, but they still have no way to understand how the individual patient in front of them will respond to any of the 12 to 15 first-line treatments available. So what they do is they take a trial and error approach. They take a drug they're comfortable with, take it out of the hat, try it with the patient. It works, great. If it doesn't, they'll try the next one and the next one and the next one. Obviously, this is distressing for the patient, distressing for their families to go through continued treatment trials, and also their probability of remission decreases with each failed trial. And then you have the potential risk that a patient moves into treatment-resistant depression, TRD. Our goal is to help the patient to get on the right drug earlier in this cycle, helping more patients to get to remission, as I say, and to get to remission faster. And the AI model that we've developed to do this is actually the same one with which we're competing in the multi-year $5 million global IBM Watson AIX prize. This is a prize that opened in December of 2016. I think there were over 10,000 teams interested, over 700 companies applied, and the only goal was solving the world's grand challenges. So we were competing with fintech, with clean tech, with robotics, with every application of AI in any industry that you can imagine. And depression is a pretty big challenge. It's the leading cause of medical disability worldwide, according to the WHO. So we entered probably one of the smallest and definitely one of the youngest teams in December 2016. We were number 2 in the world in the first round, number 1 in the world in the second round. When we had the semifinals last year, we became the last team not only representing Quebec, but representing the whole of Canada. And we were very excited to announce, actually just last month, that we are now one of the top 3 teams in the world competing for the grand prize. And the finals are this fall. So I ask you all very kindly to kind of keep your fingers crossed for us. We're hoping for a win, but either way, we're very proud and very honored to really come through over 4 years of a very, very rigorous process that not only looked at the quality of what we've built, but looked at the impact that our technology was able to have, and really baked safety and ethics into the way that we think about development of our AI technology from the very beginning. So these are definitely areas that have come to the fore in particularly the last few years. They've been baked into the way that we approach AI from really our very earliest stages. So I would be glad to talk to anyone who has more interest in Aifred, has more interest in the prize, wants to learn more about the great benefits that we've had from the startup ecosystem in Quebec. I hope one day to travel back to Maine. It's been many years since I've been in Maine. We're actually not far. We're only about 50 miles from the US border. And hopefully we'll see an ability to meet face-to-face in the near future. But I'm very happy to answer any questions or have a chat with anyone who'd like to learn more about Aifred.
Thank you so much, Marina, and congratulations on your successes. And we are keeping our fingers crossed.
Thank you.
Okay, so we're going to move on to our Q&A now, and I do have a couple questions, but if anybody would like to ask some more questions, please just leave them in the chat or raise your virtual hand to ask them in person. The first question I see here is for Dr. Scarpino. Will you be utilizing data generated from the NIH N3C program? And we need you to unmute.
Still on mute. Yeah, sorry. I'm actually not familiar with the program, so I can't answer the question, unfortunately.
That's okay. Then, yeah, that's definitely something to look into then. Okay, I do see another question for you, so don't mute. So it's from Michael Vildick. This question is for Professor Scarpino. Okay, I am applying for the Experiential AI Postdoctoral Research Fellowship, and I was just wondering how your research relates or is intertwined with Professor Vespignani's research, if it is at all.
Yeah, briefly. So Professor Vespignani's the director of the Network Science Institute. He's one of the world's leading experts on forecasting for infectious disease outbreaks and has been a major researcher for the COVID-19 response. He and I are close collaborators and have published regularly together over the past year. So our research groups overlap quite a bit, and we work together regularly.
Great, thank you so much. I see a question from Marina. Marina, are your customers only MDs? Do you know if there's a move to expand prescribing privileges in mental health in the US? And does this expand your customer base?
I think that's a great question. So when we think of our customers, we think of hospitals, we think of health networks, we think of ACOs and IDNs. So we're selling a license to actually the provider or the managed care provider. The doctors and the patients are the users, but we have a very strong point of principle of free at the point of care. We don't want either doctors or patients to be restricted in the use of our tool because they are worried about how they are going to cover its costs. And we have a very strong value proposition to particularly managed care providers because of the impact that reducing hospital visits, particularly ER visits, reducing inpatient stays, has on the bottom line of those customers. So there's a very strong value-based care proposition for those customers. In terms of expanding prescribing privileges, there's no specific moves that I know of that are only aligned to mental health. I will say, though, that we've looked at all types of prescribers in the development of our tool. So our tool can be used by nurse practitioners as well as specialists and as well as PCPs.
Okay, perfect. Thank you so much. Do we have any other questions? If anybody would like to just ask a question in person, just please unmute yourself. Now or never, guys. Okay, looks like we don't. So I'm just going to use 2 minutes to talk about BioME and what we have planned. So our next coffee hour will be mid-April, so please stay tuned. We're talking to the speakers right now. We also have our BioME Student Showcase planned for April. That's going to be April 28th and 29th, and it's a competition for students, for life science students, both high school and college, to highlight their research. I hope there is research happening despite the closings and the pandemic. There is some cash that we're giving out as prizes, so it's an exciting opportunity. We also just launched a scholarship program that's also for life science students. Please look into it. It's all on our website, biome.org. So basically, we're giving away money to, advance opportunities and to make sure that our Maine students are staying in Maine and that they have a lot of support here. I wanted to thank all of our speakers today. I learned a lot. I think AI is still kind of a blur for a lot of people, but every time we do an event like this, we are getting closer to understanding, and we're also very excited about the RU being in Portland. So that's something everybody should be looking into, I think. And I wanted to wish you a great rest of your week and see you in April. Bye, everybody.